Hi, I'm Dr. David Chew, consultant cardiologist at Cardiac Vascular Sentral, Kuala Lumpur. Heart failure is a condition where the heart is not able to pump adequately to meet the requirements of the body. The heart functions as a pump and needs to fill with blood and then eject out the blood. When there is a problem with filling of the blood into the heart or ejection of blood out of the heart to flow to the bodies, then the person can get heart failure. Heart failure is believed to affect up to 1% of the adult population. However, as people get older, the incidence of heart failure actually increases. In people above the age of 70, up to 10% of them may suffer from heart failure. Symptoms of heart failure include shortness of breath on exertion. This is probably the most common symptom. Patients will feel difficulty in breathing. Sometimes the breathing problems become worse when they lie down, and it's better when they sit up. Another common symptom that a person with heart failure may have is feeling tired or fatigue. Sometimes there is a fluid retention, and this causes swelling in the legs and also in the abdomen. Swelling in the legs and abdomen can lead to a bloating sensation, and some patients may experience a loss of appetite. Heart failure can be due to coronary heart disease, which is probably the most important cause. Another important cause of heart failure is hypertension. High blood pressure is very common. Not everybody with high blood pressure gets heart failure, but in the long term, especially if the blood pressure is not well controlled, this can lead to heart failure. Another cause of heart failure is heart muscle disease, which is medically referred to as cardiomyopathy. So if a person has heart failure, they will need to take the appropriate medications prescribed by the doctor. It is also important for them to know more about their condition and to monitor the symptoms themselves. They would need to control fluid intake. Sometimes the doctors may actually ask them to restrict the fluid intake if they tend to get fluid retention. It is important for patients who have heart failure to also lead a healthy lifestyle, to exercise regularly, and to be able to monitor the symptoms themselves. So for patients who want to have more information, they can look up this website called Spotlight on Heart Failure.my.